Hello, my name is John Murky from Bylight Consulting. I am co-chair of the IHE's IT Infrastructure Technical Committee, and this is going to be a presentation on the newly published Sharing of IPS Profile from IHE. So today we're going to be covering a couple of different things. Just some foundations on what is an IPS. I'm not going to go into too much detail because that's covered by others. We're then going to go into some foundation on document sharing. Again, I'm not going to go into too much detail as there are some other webinars on that. Then we're going to go into the specifics of this Sharing of IPS Implementation Guide or Profile. And then we're going to end up discussing some other relevant profiles from IHE that are related. So first up, what is the IPS? The IPS is a cross-SDO initiative. The SDOs had an unprecedented collaboration on this initiative. Each provided standards artifacts designed to be complementary and highlighting the strengths of each of the SDOs. CEN and ISO provide specifications that define the data model and the IPS content. HL7 contributed 2 implementation guides designed to assist implementers with both FHIR and CDA. SNOMED International supplied a free IPS terminology set with accompanying hierarchical ontologies, and IHE supplies the profiles designed to further address implementations and allow for rigorous conformance testing. So what is the IPS? The International Patient Summary. It's a standardized set of basic clinical data, including most important healthcare related facts. Things like medications, allergies, problems, immunization results, and procedures. A summarized version of a patient's clinical data provides health professionals the essential information needed for care. The International Patient Summary is a minimal and non-exhaustive set of basic clinical data about the patient. It is specialty agnostic, condition independent, but readily usable for all clinicians for unscheduled cross-border patient care. The IPS is a health record extract, a snapshot in time of a subject of care's health information and current health care. It is an international in scope, so a generic specification, with expected regional or country specializations expected. Although originally designed for cross-border unscheduled care, the IPS has also been implemented to support both scheduled and unscheduled care within a particular country, crossing other boundaries such as provinces, states, cities, and even organizations. Although designed to ensure global adoption across national boundaries, the IPS has been recognized as a useful tool to support care. To learn more information about IPS, their website is at internationalpatientsummary.net. At this site, you can see more about the various SDOs that are participating, the specifications that have been published, educational resources, implementations, and stakeholder benefits. So enough on IPS in this webinar. I'm now going to give you a quick introduction into document sharing from IHE. So document sharing is a family of profiles from IHE that support the communications of documents. Foundational to that is cross-enterprise document sharing, or XDS. XDS is a set of specifications based on EB-RIM that support the centralized registry that holds the metadata, either centralized or distributed document repositories that hold the documents themselves, and including some companion profiles that support things like patient ID management, values, terminology communications, consents, security, and others. This Health information exchange is intended to support many, as you can see on the screen, different authors and different consumers, from public health, from primary care, specialty hospitals, and the patient. The second profile I'm going to talk about is cross-community access. XCA is a way to federate multiple health information exchanges. Those health information exchanges might be XDS based, as you can see in the lower left, or they might be some other based. As long as you can support the queries and the retrieves, it doesn't matter if you are XDS inside. XCA allows for the federation of communities, and in the United States, our nationwide network is based on XCA. IHE's document sharing is not only about publication and query and retrieve, but there's also some push models within here as well. MHD, which is based on FHIR, allows for both support of the query retrieve that you saw previously, but also just simply pushing content to an intended recipient. XDR is using the model from XDS, but is intended to push content from one to another. There's also an XDM, which is intended to, which supports things like removable media or email. So here, there's a way to define how this content goes onto a USB stick or into a MIME email so that it can be pushed to a recipient. So we also have these push models. So I'm going to touch on very quickly the principles of a document, as they are important to document sharing. And even in this world of FHIR RESTful access, these principles are still very important, especially to the publisher of content. As the publisher gets to express their stewardship, their authentication, their context of why was this data put together, the completeness of the data. You don't end up with just a part of a message, you get the whole message. And then it's important to the consumer that it is also readable. So a key aspect of document sharing is that there is some minimal set of metadata about the document itself. This metadata helps the recipient understand what it has, or enables a recipient to have intelligent queries to discover specifically what they want. So within the metadata, there's information around the exchange. How do I get it? Where, whatever its identifiers. But also things around provenance. Who was the author? When was it created? Why was it created? Those kinds of things. Some various forms of patient identity to support long-term access to this information. Privacy aspects to support characterizing the data and how much security and privacy need to be applied to it, and a large group of descriptive elements that enable to find, okay, I want to know information from a particular care setting, or I want to know a particular kind of document. So document sharing from its very beginning was intended to be very format agnostic, so content agnostic. The metadata is there to describe what the content is, so the metadata would describe what kind of content it is, including things like that this is a CCDA or a C32. As such, the FHIR document, like the IPS, can easily be communicated without any changes to the document sharing infrastructure. Including with this is any other kind of formats like DICOM documents or PDF or JPEGs or TIFFs or even proprietary formats like maybe a Word document. With these content agnostic capabilities, there's also a set of relationships that various document entries can have with each other. Like described on the right here, where a FHIR IPS is the primary publication. And there is a bunch of derivatives off of it that are really just transforms. So everything to the right of that FHIR IPS is explained in the document metadata as transform of the IPS. So you might have a transform which is a consolidated CD8 or a C32 or even a PDF or a text file. These transforms have a relationship so that if someone has a pointer to the C32, they can see that it is a transform of the FHIR IPS, and it knows that the content in that C32 is semantically the same as the content which is in the IPS. So the document sharing profiles from IHE expect to have these other implementation guides or IHE profiles there to support things like security and privacy, patient identity and matching, provider identity, care services discovery, and workflow. To find these, go to profiles.ihe.net/ITI. So documents are great. And, as you saw from the principles of documents and you saw from the many ways of exchanging, IHE has some great solutions for communicating documents. But IHE also recognizes that consuming documents is a bigger struggle than being able to consume FHIR RESTful resources. So IHE has MXDE profile, which shows how you would take documents that have been shared, decompose them into the FHIR resources, but include provenance back to the original document so that when someone queries the FHIR API and sees an observation or an allergy, they can follow the provenance back to the document or set of documents that had that particular allergy in it. In that way, we show this provenance linkage back, which provides a foundation for the context, and you can then pull the document and use the document's further context available for you. So that was document sharing, and now we're going to move into the specific profile that's being discussed today, the sharing of IPS. So the sharing of IPS is an implementation guide that just simply takes these two worlds and brings them together. On the very far left, you have a content creator of an IPS document. On the very far right, you have content consumers of an IPS document. And what you have in the middle is the use of these implementation guides from document sharing with IHE. So within the sharing of IPS, we essentially have the IPS as on the far left and on the far right, and you have the IHE document sharing infrastructure in the middle. We have push-based models, we have query retrieve-based models, and we also have an on-demand model that I will get into. So first up is push. So in these cases, the source system knows exactly who it wants to send the information to, and it will use one of the various models of push from IHE. So in this case, the content creator creates the IPS document and uses something like MHD document source is in this particular graphic, but it might be an XDR document source, might be an XDM document source, but either way, the push happens using the profiles, MHD, XDR, XDM. And ultimately, at the other end, it gets unwrapped and is handed off to the recipient system, who gets an IPS that was originally sent. So next up is XDS. In this case, the exact same process on the left-hand side happens. The document is created and it is pushed to a repository. That repository might be local to the clinician's organization, or it might be central. And that then fills out the registration information that's managed in the Health Information Exchange. This enables a document consumer to do queries for types of documents, which might include an IPS, find that there is an IPS available, do a retrieve on it, and have the document available. So this flow is just a slight difference from the previous one. In this case, we're going to use MHD on the document source side. MHD is a FHIR-based document sharing infrastructure. It's going to publish it to its recipient, who then registers it into the repository and the registry. And on the far right-hand side is just showing MHD doing the queries and retrieves. Now, the source systems and the consuming systems do not need to both be using MHD. One could be using XDS, one could be using MHD, one could be using XCA. So one of the benefits of the document sharing infrastructures from IHE is they are all interrelatable, and because of the common metadata model, there is no loss between the models. So this flow is just slightly different than the previous one, only on the right-hand side, because XCA, which is what this is trying to show, is really all about the receive side and the ability to use initiating and responding gateways to federate your one query into queries of many different communities. So what this is simply saying is we can query through an initiating gateway, we can find that an IPS is available, and we can retrieve it, no matter how many hops away from you it is. And the third thing described here is something that I haven't yet talked about, but is extremely important to IPS, and that is on demand. Within the document sharing, from the original XDS on, there is a concept of on-demand document entries. This is where the content creator doesn't create the IPS document itself, it creates a placeholder, metadata placeholder that says, I could create an IPS for anyone at any time that wants an IPS created. This is a contract, so to speak. It says, I will create a fresh IPS if you ask for it. A consuming can see that this is an on-demand request as different from a snapshot, and it can request that on-demand creation of an IPS. When that happens, the actual source system, through automation software, assembles together a IPS, a summary. It will use the information it has at that time. It will use the policies at that time, which means that that particular IPS may be different than an IPS that was pulled a couple of years earlier, because the current one will have any lab results that have happened in that meantime. So an on-demand IPS is very important, especially because an IPS is a summary. And as a summary, you want the current information. So what are the details within the sharing of IPS? There really isn't that many requirements within here. The sIPS is intended to bring these two worlds together and show that they do work well together. But there are some requirements. Content creators must make conformant IPS documents. and we will test as that they are conformant to the HL7 IPS content specification. In this way, we're not changing the HL7 IPS, we are leveraging the HL7 IPS. We do define a particular format code. Now, a format code is one of those metadatas that would inform the recipient, hey, this document was created as a IPS conformant document. So we have a defined format code. Now, in this case, we're very much leveraging some artifacts that come from HL7's IPS implementation guide. The content creators and content consumers must be grouped with at least one of the document sharing transports: XDS, XCA, XDR, XDM, MHD, MHDS, etc., etc. And that grouping would be expressed in a product labeling document called an IHE integration statement. That integration statement allows people who are looking for solutions to be able to tell, oh, this particular system can use XDS, XDR, and XDM with its IPS capabilities. Content consumers must have some use of the content, and we're kind of loose on that particular because we want to enable content consumers that do nothing but display the information. That may be a perfectly legitimate thing. So what is their use? Their use will be defined by their application's needs. There are some other IHE profiles that are likely to be using the IPS in the coming future. So sIPS being presented today is simply about communicating a generic IPS over document sharing. Some of the other use cases that are going to be consuming an IPS are things like the EMS and EMT community want to be able to consume medical summaries, and an IPS looks like a good thing to consume. Today they're looking at consuming consolidated CDA summaries. IHE is also going to be deriving off of the IPS for some specific use cases, like occupational data for health option, which adds some social history section to the IPS, or within maternal health, where we use it to define an antepartum summary. So an important part of an IHE profile like sharing of IPS is that we have testing specifications built off of the specification, built off of the sIPS, including procedures and test toolings. So at the IHE Connectathon, we will be testing that the IPS that's created are conformant to HL7's IPS. This is going to be using the HL7 and MITRE validation tooling. So we're using the validator that HL7 is defining for their particular content. We are testing the document sharing using the IHE's Gazelle and NIST test tooling that have been testing document sharing for a couple of decades. And then 3, we add 1 and 2 together to get 3. We are testing that the IPS can be queried for, retrieved for, published, or pushed, or consumed. So the fact that the document sharing infrastructure is used to carry the IPS is part of that testing. And sharing of IPS is just a foundational piece. We definitely expect that there are going to be higher level use cases, things like transfers of care, things like EMS support or EMS transport or maternal health or plan of cares. Those then would be built on further testing above and beyond step 1, 2, and 3. And then the other aspect, the other way that we get deeper testing is through regional specifications like the USA or Netherlands or Switzerland or Italy, etc. So regional specifications might further refine the IPS, or might further refine the way that the metadata has to be populated. In that way, that specialization can then be tested either at regional projectathons, or those can be elevated up to international requirements. So I probably haven't answered all of your questions or provided all of the details that you're interested in on either the IPS or document sharing, or even just the Sharing of IPS implementation guide. So I do offer up that you can ask me questions through my email. Thank you.